So pregnancy is usually a very exciting, happy time in a woman's life. But, for some, if not most women, it can also be associated with some not so pleasant symptoms. So anything from, the morning sickness, nausea, bloated, constipation, lack of energy, to really, back pain and moodiness. So you see in the cartoon there, the nesting instinct can be replaced by a more stronger instinct to sit on the couch and eat ice cream all day. But I'm sure we all know people who suffer that same instinct who are not pregnant. So back pain, extremely common during pregnancy. So anywhere from 50 to 75% of women will suffer some kind of low back or pelvic girdle pain during pregnancy. So we're talking very large numbers here. Many of the physiologic and morphological changes that occur during pregnancy that contribute to low back pain can persist for 4 to 6 weeks postpartum. But the good news is that most of this pain will disappear within 1 to 3 months after delivery. So what are some of the causes of low back pain during pregnancy? So you could blame usually hormones. So one of the hormones of pregnancy called relaxin it's a hormone that allows ligaments to soften and joints to loosen in order to prepare for the birth process. But this increased mobility can be a major source of discomfort and pain, especially with walking or going up and down stairs. So sacroiliac joint, that's probably the most common area where women will get discomfort during pregnancy. And this is the joint where the low back meets the hip. So, you could see in the picture here, we're talking about this joint over here. And under normal circumstances, there's really very little motion that occurs at this joint. So we're talking maybe a couple of millimeters in sliding, and it can tilt and rotate maybe 2 or 3 degrees. However, thanks to relaxin, this joint really loosens up, starts moving more during pregnancy, and that can become a major source of discomfort. So, sharp pain that you could feel really at the area, low back, but even sometimes it can be referred into the anterior, posterior thigh, or even the groin. So another very common area where women will get low back pain or pelvic pain really during pregnancy is the pubic symphysis. So I'm talking this joint down here. So similar to the sacroiliac joint, usually there's very little motion that occurs there. But again, thanks to relaxin, this joint will loosen, and in extreme cases can even separate. So in this x-ray here, you can actually see a visible separation, and you can imagine that that can become a major source of pain, in the pelvis, groin, hips, and buttocks. So other causes of low back pain during pregnancy is that center of gravity actually changes. So as the uterus gets bigger, baby's developing, you see the center of gravity shifts forward. In order to prevent from actually toppling over, posture will change on its own, and you get this increased curvature in the low back, or what we call an increased lordosis. And this increased curvature can put a lot of strain in the low back and pelvis. So sciatica, luckily it's very uncommon during pregnancy, so only really about 1% of pregnant women will suffer from true sciatica. The sciatic nerve is actually the largest nerve in the body, and it provides sensory and motor function to the lower extremity. During pregnancy, the growing uterus and baby can put direct pressure on the sciatic nerve, or more commonly, you'll get sciatica from a herniated disc in the low back. So when someone suffers from what we call sciatica, that can be a lot of pain in the low back, pain that shoots down the leg, associated numbness, tingling, and sometimes even weakness in the leg. So other causes, so like I spoke about, because of the center of gravity changes, you get this increased lordosis. So poor posture, as you can see here, shoulders are kind of back, and this will put a lot of pressure in her low back and pelvis. Tight hip flexors from sitting too long. So when the hip flexors are extremely tight, the back's going to move more to compensate, and you're going to get more pressure through the back, more pain. As the uterus grows, you can actually get abdominal muscle separation. So you can think of the abdominal muscles, or what we call the core muscles, as your corset. So they really provide, stability, through the low back. And when these muscles separate, you're going to get a lot more pressure and pain through the lower back. So risk factors for back pain during pregnancy. Women who've had back pain prior to becoming pregnant are at an increased risk. If you had back pain with previous pregnancies, you're more likely to get back pain during your current pregnancy. Women who are very sedentary or have poor flexibility, weak back and abdominal muscles are at increased risk. And of course, if you're carrying twins or even triplets or multiplets, you're going to have a higher risk of back pain. You can think of that just from the increased weight gain and, larger uterus. So luckily, there's a lot of things you can do to try to ease or decrease back pain during pregnancy. So one is just practicing correct posture. You know, shifting weight if you're standing for a long amount of time. So you see in this picture here, if you're standing, just putting a small stool down and lifting your foot up is going to take some pressure off of your low back. Making sure to lift correctly, so you never want to, you know, bend at the waist. Instead, if you're going to pick something up, you want to actually bend at your knees and your hips. Not making any sudden reaching motions. Side lying while sleeping can be very helpful. So they actually make these special pillows you can sleep on at night, which will, you know, can help a lot of women. And then exercise. So really pelvic stabilization, back stretches, abdominal strengthening. This can be very helpful. So some of the benefits of exercise during pregnancy. So, you know, it reduces backaches, constipation, bloating, swelling, increases energy, improves mood, it improves posture, really improves circulation, you know, promotes muscle tone, strength, endurance, and stamina, and it also increases likelihood of having an easier, shorter, and less complicated labor. So other benefits, you know, helps women sleep better at night. Studies have shown burns calories, so it helps maintain healthy and steady weight gain during pregnancy. Studies have also shown it can reduce the risk of gestational diabetes, helps control increased blood pressure, and it accelerates postpartum weight loss and recovery time. So, you know, to sum up past 2 slides, exercise is awesome. You know, so other treatments we can do. Heat and ice. So you could think of ice like topical Advil. It's an anti-inflammatory. You just put it on a sore spot. It can be very helpful. Heat can be helpful. So that's really helps more with kind of muscle spasm, loosens up muscles, and can be very helpful. Wearing low-heeled shoes with good arch support. So again, you want to kind of stay away from those 6-inch stilettos. I guess not only is it not great for your feet, it actually puts your posture into more lordosis, so you're going to put more strain through the back when you're in those high-heeled shoes. Studies have shown acupuncture can be very helpful, and it's actually been shown to be safe during pregnancy. Physical therapy, again, to really work on strengthening muscles can be very helpful. And then we even have things called sacral belts. So for women who suffer from sacroiliac joint pain during pregnancy, these belts can be very helpful, kind of provide some support to that joint, and, you know, decreases some of the mobility you're going to get there. So what are some of the red flags or things we really look out for, or things that would suggest something more serious going on? So back pain that's very severe, it's getting progressively worse, caused by trauma or accompanied by fever. You know, this becomes more worrisome. If you get loss of feeling in one or both legs, you become suddenly uncoordinated or weak. Loss of sensation, buttocks growing, or bowel bladder incontinence. So this all suggests something more serious. You know, it could be a spinal cord injury, and that's something should seek attention straight away. I just want to mention that low back pain in the late 2nd or 3rd trimester can actually be a sign of preterm labor, especially if there was no back pain prior. And then pain under one or both kind of ribs or side could be a kidney infection, especially if accompanied by fever, nausea, or blood in the urine. So in summary, low back pain, extremely common during pregnancy. Most common is sacroiliac joint pain. And good news is it often improves with exercise and time, and you usually get a cute, cuddly person in the end to help you forget about it. So.